Hi everybody, I'm DeLaney Gabriel and it's May 15th, 2020. This video has to do with my ordering lab tests for people or recommending lab tests for them to get through their doctors. A fairly serious incident came up this week where one of my long-term clients, long-term meaning probably 28 years, she called me and left a message because I couldn't take the call, and she needed emergency care for her daughter who was having something to the extent of a nervous breakdown and had been very depressed and so forth. So she wanted me to let her know what blood tests she should have her daughter's doctor run. And her daughter at this point is probably maybe 28 or 30 years old because I haven't seen either of them for quite a while. So what I had to tell her was that although it was an emergency, that I couldn't make any recommendations for blood tests because I can only do that if someone is a current client, and current meaning that I've even seen them or had an appointment with them for a full health history within 2 weeks. Other than that, it's really unethical for your doctor or me or anybody to order blood tests for you without current information. Of course, there are times where your physician may want to just have you get your glucose checked or A1C for diabetes or your cholesterol, something of that nature. But for full health care, that requires a current appointment. So when I told my client this, she was really disappointed and didn't know what to do. And they have Kaiser, so I just told her, do the best they can, let her doctor run whatever lab test he feels is important. And what the woman, my client, said to me, the mother, said that she is concerned that it's hormones and she just feels like the doctor probably won't order any hormone tests, to which I fully agreed. So from there, I tried to explain to her all of the different points about why I couldn't do it and why I had to see her daughter and all of that kind of thing. But I know that the mother was so kind of rattled because it was such an urgent situation that she didn't really take in all that I was telling her. So I told her I would do a video for her to give her more details because I didn't want her to think that I just wasn't giving her good care anymore or that I didn't care about them. But what I do in my work, and it's really important to me, is that I don't just focus on what is wrong, that I work as much as I can to get full and complete information to get the big picture of things. And I know that's not always what people want, but it's always what I want and I believe is best. Especially because I'm well known to be an anti-aging specialist because I've been doing that since, well, starting in '88 and then considered myself a specialist beginning in 1990. So people think that I should just tell them what hormone tests to have run. But again, without a current history and information and some kind of decision-making process that we would go through, I just feel it's unethical for me to do that for anybody. So what I always want, again, is a full appointment looking at all the symptoms that somebody may be having and not just focusing on hormones. I always want a comprehensive metabolic panel as well, and vitamin D and C-reactive protein, CoQ10, a lot of the other things that maybe aren't run just every few months, but should be run at least yearly to assess the benefits that they're getting from taking supplements or to see if that level is correct. Anyway, so what I like to do is have at least a comprehensive metabolic panel to look into liver function and kidney function and certainly cardiovascular health Because even for taking hormones, it's important to know that the kidneys are not on overload, that it's important to know that a BUN, blood urea nitrogen, is not high, which could show some kidney stress. And that often happens with people, especially in the aging process. Then I look at uric acid to make sure that there's not a gout situation. In situations of depression or nervous breakdown, I certainly do want to look at brain chemistry and at hormones, including catecholamine, serotonin. All the dopamine levels are really, really important there. And in this case, I know the mother is so concerned that the daughter was held in the hospital for 5 days before she was released. And then she was put on some very potent antidepressants that the mother doesn't want her to take, and the daughter especially does not want to be on those at all. And according to the telephone appointment or telephone call that I had with her mother today, the daughter is just not doing well and is really suffering. So what I want to do, again, they're going to drive down to Santa Barbara to see me on Monday, and I'll be able to get a full health history and find out what all is going on. And then I can write a letter that she can take to her doctor at Kaiser, and we'll see what the doctor at Kaiser will run. Most of the time, what I find is that doctors just don't understand or don't believe in the connection to hormones and depression, and they just use antidepressants to solve the issues. And what I look at are for hormonal imbalances or hormonal deficiencies, and if those exist, then I set out to do my best to treat those. So this video definitely will go out to the mother and the daughter to let them know that I wasn't betraying them in any way, and that actually what I was doing was providing the best of care so that she could get emergency care. And then when things calm down a little bit, then we can take a look at the other things that are causing her to feel as she does. So I hope this information is very, very helpful. I know that depression and all the stress that's going on right now with the COVID and masks and everything has made it even harder on people financially, and they're feeling kind of locked in and under lockdown. So I just hope that all the people who can use the benefits of this video will check it out. Anyway, happy Friday, happy day to you. It's been a difficult week here because there's been so many urgent things like this. So I'm not in the most chipper of moods, but I felt like it was just really important for you to have this information. And again, I hope it's really helpful. I always wish you all the best of help, and let me know if I can help you in any way, and certainly check with your doctor and work hard to get the help that you need and that soothes your soul to where you really know that you're on the right track. So that's it for me. Bye for now. Thanks again for watching.